Hi, I'm Dr. Rena Azar, and I'm going to talk today a little bit about hormones and vaginal health. I'm specifically going to talk about hormones that are meant to help the vagina be healthier, meaning applied usually intravaginally. I'm not going to discuss the specific agents that we use for this, but I just want to talk about how important hormones are to use perioperatively. And actually, for anybody that has vaginal surgery, I think hormones long term are good. I'm talking about vaginal hormones that are applied in the vagina. We start these often for people who are around the time of change of life, menopause, or after menopause. And the reason is because there's a natural aging process that affects the vaginal health, which in turn affects a lot of other things. And I will talk about that. So we see that this aging over time, and then also after the change of life when estrogen levels are low, or sometimes even before the change of life. When we have menopause, we know that the ovaries shut down, we produce less estrogen and eventually almost no estrogen. But actually there are some conditions like postpartum, and there are some people who, like polycystic ovarian people, sometimes will have actually low estrogen levels even before their change of life. At any rate, when I'm looking at doing a surgery on somebody, I feel like it's really important to have a discussion with them about the fact that it would be ideal for them to be on hormone replacement therapy that we apply vaginally. The nice thing about vaginally applied hormone replacement therapy is that we have many studies that are 20 plus years in duration that demonstrate no increased risk for blood clots or breast cancer, because the local application of estrogen in the vagina does not get absorbed systemically. And we even follow people's blood levels to demonstrate that in certain situations. For example, somebody who has had a personal history of breast cancer. So using estrogen replacement therapy can be very healthy and very helpful for preparation to have surgery. And the reason is because when we age and when we have less estrogen in our system, the vaginal tissue, which is a mucosal tissue, much like we have in our mouth and our nose, it's mucosal, it's not dry like our outside normal skin. And that mucosal tissue is very dependent upon being moist. And the way that we get moisture in that area is because there are little glands that are underneath the surface of the vaginal skin. And those little glands produce moisture products. And when we are getting older, and as our estrogen levels get lower, those glands become less numerous and less productive. In addition, the blood supply starts to go away. So we have less blood supply in the vagina when we have less estrogen effect. And you can imagine that both of those things affect post-operative healing and post-operative vaginal health. It's really important, if we can, to do hormone replacement therapy in the vaginal area before surgery. That helps the tissue in the vagina to become thicker, to have a better blood supply, and to be more moist. And those are very, very important things in helping with vaginal health. Another lesser known fact is that there is a biome, or there are natural little bacteria and fungal elements that live in the vaginal area. They're actually healthy. They're not terribly numerous. They're in the vaginal area and they live in harmony with us. But when we have tissue that is thinning and dry, the healthy bacteria become unhealthy, and bad bacteria, other types of bacteria, take advantage of that warm, moist environment. They kind of move in and they kick out the good bacteria, and we are much more prone to poor healing and infections that go hand in hand. So that's another way that lack of estrogen, lack of vaginal health can cause problems with post-operative healing. So I like people to do ideally some hormone replacement. We usually start out with vaginally applied estrogen because it is better, actually better paid for by insurance companies, although we do have some other agents we can work with. Also, I think, especially if you're starting out with tissue that's already has a compromise to the blood supply and moisture, because it's moist and it spreads all over, it probably gets absorbed a little better than maybe a tablet or a pill or a suppository. So to start out with before the blood supply down there is very good. I think it's a good thing to use. And then post-operatively, even though I'll have you hold on those vaginally applied estrogens for a little while immediately post-operatively, because I don't want you putting something into your vagina, I'll usually want you to start them within 2 to 4 weeks out from surgery. And I want to emphasize that, in my opinion, and my preference would be for you as your surgeon to use some type of vaginal estrogen supplementation long-term. It's especially important postoperatively to help the blood supply to start growing back in there. Estrogen actually recruits the blood supply. It says, come on here, come back here and start growing in here. Not only do we have the compromise of our age, making the tissue have less blood supply, but surgery, when I get in there and I open those surfaces up and I restructure things, you lose some of your blood supply. So the estrogen cream application helps the blood supply to grow back healthier and faster. So, and it also keeps that tissue healthier long term. So I really like people to do it postoperatively when I give the go, or I should say actually when the nurse practitioners give the go. But also importantly, I'm going to tell everybody that long-term vaginal application of estrogen replacement therapy is important for your vaginal health and will help to preserve the work we did to make that area pretty and make that area work well. So long-term, I mean lifelong. So, and we'll usually taper it down. For example, with vaginal cream, we would do probably twice a week for most people, long-term, even though we might use more than that up front or immediately perioperatively. So that is why we like to use hormone replacement therapy in the vaginal area. I'll add on that we have multiple agents. We have not just cream, which is better paid for by the insurance companies, but there are some tablet suppositories and some little capsules that you can use. There's also an oral pill that's not technically estrogen, but it builds the estrogen effect in the vagina. We can help to try to get those pre-authorized if you so desire. You want to do those preferably long term. So we work with people and we'll try to do what we can to get you things paid for, but please remember that hormone replacement therapy in the vaginal area is very important for your health and for your postoperative healing and for your postoperative long-term results.